my timer. Right, thanks so much, Dan. So yes, my name is Marie Rogers. I work as a Senior Analytical Manager at NHS England, and I worked on this project with Richard Pilbery, who works for the Yorkshire Ambulance Service, and I was mentored by Honora Smith. So as Dan's just mentioned, we're all very aware that there's a huge workforce challenge at the moment, and it's of interest to a wide range of people, from those working in providers, patients themselves, politicians, journalists, general public, managers, and it's also a key component of the NHS long-term workforce plan to improve workforce retention. So the problem is that there's a large amount of interest and there is lots of data out there about this topic, but it's really disparate. It's located in lots of different places. There isn't really anything bringing it together and giving a narrative or a way for interested parties to explore this information. So my approach to this problem was firstly to create a model, a kind of classic multiple linear regression, drawing together factors that we know are related to NHS workforce retention, and then determining what the impact of those factors are. I'm doing this in an open source way, so anyone can access this model and adapt it for their own needs. Furthermore, to create a data dashboard in a Python library called Plotly, so that anyone can investigate this, explore it for themselves, and also access up-to-date data, have a way of regularly updating that information. So just to clarify the definition of my key variable of interest, which is turnover rate. So there's published information about this where it's the full-time equivalent number of staff who leave their organisation in a year divided by the average staff in post for that organisation and staff group in the year. So to do this, the workflow was to scrape the publicly available data from the internet, then process and wrangle it into a form that can be used by the model and by a dashboard, to conduct the regression model, to understand the key drivers of turnover, and to create a dashboard so users can explore this information. Some of the findings here, just at a very top level before I demo the dashboard. So this is the general pattern we see across staff groups and regions and organisations, that turnover rate prior to the pandemic was relatively stable or declining very slowly. During the pandemic, when there was nowhere for people to go, turnover rates went down a lot. And then it started to increase again around summer 2021. There was kind of a post-pandemic bounce back effect where perhaps those people who would have left during the pandemic period leave, say retire or move on or want a different experience. And then now in the latest data, which is around August 2023, the rates have roughly come back in line with their pre-pandemic rates. And the dashboard allows you to explore whether this is the case by staff group and organisation. We also have information about staff sickness rates. We know that the two are highly related, in that organisations with higher staff sickness tend to have also higher turnover. Just some very top level information about how sickness related to things like anxiety and stress is the leading cause of days lost. So now I'm going to hope the dashboard demo works. So Richard really led the way on doing this work. It's built in a library called Plotly, as I mentioned, and it allows you to view staff turnover by staff group, so you can select more than one and compare them here. And then you can also see this by region, so turnover rates for nurses and health visitors in London, or you can go to the organisation level. Some of them are a bit wild because maybe they have small numbers. Then there's also data on staff sickness rates that can be explored in the same way. And this is all publicly available data, as I've mentioned, mainly published by NHS Digital, but just presented in a more accessible way. We also have data at the national level about staff sickness reasons. So it's percentage of days lost by reason and by staff group. Just returning to the presentation. It'll reappear for me again. So the other thing I mentioned that we did was a multiple regression, taking a look at some of the things we know relates to staff retention and determining exactly what impact it has, which are the main drivers and what are the most significant or have the highest impact. So when we did this model, it accounted for 13% of the variation in turnover, and the main drivers coming out were organisations with sickness absence due to mental health tended to have higher turnover rates, where a 1% increase in sickness absence due to mental health was associated with a 28% increase in turnover rates. Organisations where the reasons for leaving data indicated more staff were leaving due to negative reasons, so things such as leaving due to poor work-life balance or bad working relationships, as you might expect, those organisations had higher turnover rates. Another factor which I was aware of from the literature, local unemployment rates. So organisations in areas that have higher local unemployment rates tend to have lower turnover rates because naturally there's less opportunities for staff to leave too. So it's not exactly a positive reason for turnover rates to be lower, but that's something that comes out of the model. Both the dashboard and the model are still in development, so these figures, I want to nail them down a little bit more before going further with them, but this gives you an indication of what kind of things we're finding. So the impact of the work, a range of users will be able to access this open information in a dashboard format. All of the code that we use to do this is published on GitHub, so anyone can adapt this for themselves. As I've mentioned, there is quite a lot of published literature on this area, and the model is really in line with the things that have been found, for example, in this report by the Institute for Fiscal Studies. And finally, some challenges and kind of interesting points about this work and the HSMA course for me. So originally I was very excited by the idea of forecasting turnover, and there was a library covered and a technique in HSMA called Profit, but the data were just not as granular as I needed to be able to do this forecasting thing. But the GitHub repository covers my attempt at this, so you can see the method, and maybe with more granular data I could return to that idea. Data scraping was definitely the hardest part of this project because people publish in different formats and it changes over time, so a surprise at how long that took. Using Python to create a dashboard was new for me because there's lots of software that we use in my day-to-day job that covers this. but Python was kind of an exciting new challenge as a way. And then finally, working with a collaborator, Richard, was really useful and brought a really great perspective to this work. And it also required that I learn GitHub, not just for publishing the code, but for collaboration, version control, things like merging our edits. I really took a lot away from that. Okay, that's the end of my presentation. I'll stop sharing now.